Any indication about how the caregivers in Dallas, the nurse that we heard about earlier, and now the second worker might have contracted the disease? They're certainly still investigating, but what are people saying?
Right, so the CDC is saying there is an ongoing investigation into this. However, quite a few experts in this field, in terms of contamination experts, they're saying that the chances are that it's something to do with the way that the protective gear people are wearing being taken off has been crucial. And there's little details, this lady in Australia was talking about this, that essentially you take one glove off with one hand and then you have to use a bare finger to hook the other gloves.
And that might have been a point of contact.
Things like that may have been a point of contact. That's the kind of thing they're going to be looking into.
So, okay, so if a new case does crop up once again in the U.S. somewhere else, and we hope that that doesn't happen, what preparations are being made to prepare to care for that potential patient? I mean, people have had time to see the worst practices and the best practices.
Right. I mean, you mentioned there the sort of shock team of troops that the CDC will be sending in around the country. They also talked yesterday in their press conference, Tom Keene, talking about the fact there'll be about 50 different hospitals. Each state will have a designated hospital. However, some epidemiologists saying this could be a concern, because if a patient walks into hospital A and is then told you're going to be transported to hospital B, that's going to be yet another possibility of transmission. So that's something they're looking at as well.
Is the CDC actually coordinating all this, or are hospitals and states acting kind of ad hoc?
Well, we reached out to, I think, the 50 top earning hospitals yesterday to try and get responses. What is their level of preparedness? Right. And all of them that did get back to us, and that was very few, I should add, said that obviously they're coordinating very closely with the CDC on this and state health officials. So it's seemingly quite ad hoc. I think that after yesterday's new guidelines were issued, that will be something that they'll all be trying to implement uniformly.
Do you get the sense as you talk to these hospitals around the country that there's a sense of disbelief? In other words, well, what happened in Dallas couldn't possibly happen here in Indiana?
No, I think that the professionals I spoke to yesterday did say that there are smaller hospitals that are not prepared to deal with these kinds of things, and Dallas Presbyterian may be one of those. I think that the larger research-focused places like Emory, we've seen where they've been successfully able to treat Ebola, are much more prepared for this kind of outbreak. But, you know, the thousands of hospitals around the United States, many of them far too small without the experience.
I'll tell you what scares me, Scarlett, and again, not to be alarmist, but we're out of vaccine, and Glaxo says, well, it will have 20,000 vaccines available. They won't be till December, so that's, 8-9 weeks away.
And of course, vaccines wouldn't help anyone who's infected already. I mean, now you're just dealing with experimental
Absolutely.
treatment.
It's going to be an expensive process, whatever. I mean, all of these hospitals we reached out to, they're going to have a huge impact on their bottom lines. Just in terms of the way that you treat these patients, it's a very expensive process. The vaccine is part of that.
Helima Croft of RBC Capital Markets, you just returned to work after changing jobs. You not only walked into a sell-off in oil prices, but also the Ebola virus situation getting worse and worse. Does this come up at all in your conversations with clients?
Well, it does in terms of potentially emerging market stories. And I highlighted Nigeria before in terms of a country at risk. I mean, Nigeria was very lucky. It's Africa's most populous country. Yeah. It is a great emerging market story that people like to talk about. They were very lucky that they were able to contain Ebola. I would look at a country like that and say, if you get into a situation there, that could have huge ramifications for investors. You
famously made a name for yourself at the CIA as a risk analyst, and that's what ultimately took you to Wall Street. Can you quantify it, and maybe this is unfair, but quantify Ebola as a risk to financial markets? Is that a fair jump?
Well, I think people have been looking at what it could be shaving off in terms of African economies. And so, to me, I think right now, I'm most interested in what it means as an EM story right now. Again, I would look at countries like Nigeria, where everyone was so focused on as being this engine of African growth. Again, they were lucky. But if you get a second wave of this there, then you could really have problems, and you could really sort of derail that story. Investors are not going to want to go live in Lagos if you have an Ebola outbreak.
Right. Yeah, that's a good point. All right, Willem, Marx, thank you so much for sharing us the details of your findings on this second case of an Ebola worker, a healthcare worker who has contracted Ebola.